Hey guys, welcome back to my channel. So today I am going to tell you guys about my first year as a nurse practitioner. I cannot believe that I've practiced for an entire year. Let me see. Actually, it's a little bit over a year. Let's see. I started practicing in September. Wow, it's been like 1 year and 4 months. So I just want to kind of tell you guys my struggles and what I've been through and just how it's gone, like how I've done. I feel like overall I've done really well. I'm very proud of myself. I'm really proud of myself. You know, none of us like to toot our own horns, but toot toot, I made it for a year. Oh my gosh, I'm so excited. So let's get started. I have my iPad here, and so if I'm looking down over this way, I'm just trying to stay on track. So the first week as a nurse practitioner was probably the scariest week of my life. It was nerve-wracking. I really didn't know what to expect. I was afraid of everything, basically, and that's normal. You're going to feel that way. Now, if you're not a nurse practitioner or you're a student, RN, LPN, and you have NP goals, then still watch this video and you should be subscribed to my channel, because if this is your goal, then you need to start surrounding yourself with people that are doing what you want to do in the future. So it kind of just keeps the dream alive, and it just keeps you on track. Like, yeah, I really want to do that. Okay, let me study a little bit more. Let me sign up for school. So surround yourself with people that are doing what you want to do. You did not find my channel too early. I had one person that follows me told me that he felt like he found my channel too early because he wasn't a nurse practitioner or a nurse practitioner student yet. And I told him, no, you should watch my videos, because one day you're gonna need them, and it will just kind of keep your interest in the goal that you have, and just make it a little bit more realistic to you. So it's like having an NP friend. So anyway, let's get started. I've got my iPad here, and I'm just going to use it to keep me on track. So right now, I have been practicing for like 1 year and 3 months, 1 year and 3 or 4 months. And when I say that, and when I look back at this journey, I just can't believe it. Cannot believe that it's been a year. Time is just going to go by so fast, especially because you're going to be busy. You're going to be trying to get adjusted to your new role, and time will just whiz on by, and before you know it, it's been a year. So basically for me, after graduation, you guys know from my other videos that I just basically took boards after studying for 3 weeks, and then I found a job within, I think, 1 month, and then I started working. So the first week I had orientation, and orientation was basically like 1 week worth of classroom stuff, learning how to do the computer system. We use ECW 10, and so that was a lot, just learning that system, because the hospital that I came from, we were using Epic. So it was like, yeah. So the first week was just learning the ins and outs of the company and the computer system and things like that. And after the week, we went to our sites. I shadowed someone for a day or two, and then I started seeing patients on my own. Now, the great thing is that I didn't go straight to seeing 18, 20 patients a day. I was seeing about 1 patient an hour at the very beginning, like 1 patient an hour. So basically it went the first few weeks, or like the first 4 or 5 weeks, I saw 50% of my schedule. And then the next few weeks, it went up to 75, and then it went up to 100%. So it was a span of about 3 months before I got to 100%. And I really like that because it gave me time to just get used to what I was doing. As a new nurse practitioner, 1 or 2 patients an hour it's going to take up the entire hour as a new NP because you're looking everything up, second guessing yourself, and you just haven't gotten that time management piece in yet. So that was the very beginning, and it all worked out. When I was heading to work, I would have that nervous feeling in my stomach, just feeling like I wanted to turn around and go back home and run back in my house because I was scared. But I didn't do that. I kept going and I kept learning and I kept growing. And I'm still growing. I'm still a baby NP, 1 year and 3 months. I have a long way to go. I'm still a novice NP. I still learn something new every day. I still ask a lot of questions. And that's the thing. I have no problem asking questions. If I don't know, I'm going to ask a question. I'm going to ask. And I'm not going to pretend like I know. I'm going to look it up. I'm going to ask questions. So just surround yourself or try to latch on to people that don't mind you asking questions, people that want you to learn, that want to teach. And thank God I do have people like that at my place of employment that don't mind that I ask a lot of questions. And I'm really happy about that. So if you don't have that, then, social media is an amazing thing. If you can find someone that's willing to invest time in you and that's willing to answer questions, then, latch on to that person. In the very beginning, I wanted validation for everything. And then at some point, I realized that you won't be able to have validation or someone saying, yep, that's right. Yes, that's right. Yes, that's right on everything. Just ask questions when you really need to, when you really feel like I need help with this. So I did learn that, and I kind of toned it down to going to people when I absolutely had to, which is why you guys know about my video with all of the books that I take to work, because I try to do things on my own first. And if I can find the answer on my own, and if I can solve the problem on my own, then I will. But if I can't, then yes, I'm going to ask questions. So that was the very beginning of my career. It's just a different time. You'll have your days that you feel like I can't do this. I had my days that I went home in tears, or I was driving in my car on my way home crying, telling my husband, I don't know. But you get over that. You really get over that. And I think most people experience those times in the very, very beginning. So progressing on, let's say 6 months later, I was feeling a bit more comfortable and a bit more confident. And looking at myself when I was talking to patients, thinking, wow, it's been 6 months and I've come this far. And then as time goes on, you just get more and more comfortable. And as I mentioned before, I still grow. I'm still a novice NP, but right now, 1 year in, when I just look at the entire journey, one of the most difficult things for me has been locking my notes on time. If I see 18 to 20 patients, at the very beginning, I had no notes locked out of all of them. I had to look them over and comb through them and make sure everything was perfect and that I documented everything. And sometimes that can just be too much and it can get overwhelming. Yes, you have to have good documentation, but you just can't go overboard or you will never finish. And that's something that I've learned and I'm still learning. So fast forwarding to today, is locking my notes still an issue? Yeah, but not as much. I've grown so much that a lot of times, if I have 20 patients, at least 10 to 12 of the notes will be locked by the end of the day. And then I can lock the rest really quick. Or so I'm getting better. I'm getting to the point where this is going to be history as far as being a problem for me, and I won't stop until it's not a problem. So if you find that you do have a problem in locking your notes or whatever it may be, just focus on fixing that. Think of ways that you can correct that. So you guys know, if you follow me on Instagram, that I have this Apple Watch. Now, the main thing about the Apple Watch is that I do my fitness stuff on here, but guess what? I'm so excited about this. Oh my gosh, calm down. So there is a timer on my watch, and I'll let you go. I don't know if you can see it. There's a timer on my watch, and I just press 15 minutes and I press start. And when I go in to see a patient, they don't know the timer's on, but I do. And it starts vibrating after like 10, if I set it for 10 minutes, it vibrates after 10 or 15. And my thing is, when I go in, we have 15 minutes with each patient. No, I don't want to use the whole 15 minutes talking, but I just want some type of alert that I've been in here for 15 minutes. I better wrap it up. And that also, another problem that I've had has been time management. When I start talking to the patients, it's like I don't know when to cut it off or when to cut them off. And you have to master that. And yeah, that's very important because you have other patients waiting. So I use my watch, I use the timer, and it just alerts me, Lada, you've been in here for 15 minutes, wrap it up. And when it starts buzzing, I don't let it ring because that's rude, but it does this little buzz. I can feel it, but they have no idea. Then I know to wrap it up. And another thing is patients that come in and want 6 or 7 things addressed. At the very beginning, I didn't know how to say no or to say, let's continue this at another visit. But now, in the most professional way, I tell my patients, so today you're here for back pain and right knee pain. And then, yeah, that's what I'm here for. And then in the middle of the visit, oh, and my eye was hurting and my hand's been hurting for 5 years. And I'll say, so today, let's just handle the 2 things, and then you can make another appointment with me and we'll handle 2 more. At max, I'll do 3, but I'm not trying to do 6 or 7 or 8 to 10 chief complaints because it's too much, and I feel like the patient won't get top-notch care with that many complaints and me trying to address them all. So far, everyone's been open to that. Like, okay, yep, I understand. And I said, we need to have this relationship where you come in when you have issues, and then when you come, you won't have 10 issues. Yep, I agree with you. That's what they say to me. I agree. You're right. So anyway, that's one of the little tricks I have up my sleeve for time management. And let me look over here and see. Another thing that I do as a new nurse practitioner is research all the time. If I encounter something that I'm not really familiar with, I can get through the visit, and then if I need to add something, of course, I'll call the patient and say, I was thinking about your case and I added a few more labs. So if you can stop by in a few days or tomorrow, that would be perfect. And what I've come to find is that what I encounter that makes me feel nervous or that I feel like, oh, I really didn't know much about that, that's what I'm going to research when I get home. That's my little, after everything is done for the day and I'm in my PJs and I'm in bed, I pull out my up-to-date or I pull out my primary care book from school or whatever I want to use for researching at that time, Hippocrates or up-to-date. I will do that at the end of the day. I always read something. I always research something every day. And as you grow and continue on this journey, you'll require less of that. But at the very beginning, at least for me, I can speak for myself, I've done lots of reading and lots of research, my journal articles and everything. And it helps because when you practice, when you know what you're doing and you know how to treat and you don't have to look everything up at that moment, things start going faster. Things start going smoother. So basically what I'm saying in this video is that this year has been a journey. I've had tears, I've had smiles, and overall I'm really happy with how things have gone. But you and I, we have to give ourselves permission to grow, because you're going to go into this as a baby and you're going to go into this just having lots of questions and everything. And some people just have an issue with that. The feeling of, I feel like I don't know what I'm doing. I mean, I know the basic stuff, but I don't feel like I know exactly what I'm doing. And you'll grow, you'll get past that. So basically, I want to kind of welcome everyone that has recently passed the certification exam, and you're a new nurse practitioner, you're looking for a job and you're feeling lost. Just to let you know that these feelings are normal and things will get better. And when you get the new job, just embrace it all. Just take it all in, take your time, ask questions, and surround yourself with people that will help you, that people that won't judge you or say, you should have known that. No one wants to hear that. If I have a question, if you would please help me, if you would help me, then okay. But if you don't want to, then okay. So yeah, even if you're finding someone on social media that's willing to help and that's kind, all the groups we have and everything are amazing. So make sure you join the Nurse Practitioner Binder group, because it's awesome. And one of the main things I try to do with the NP group is to make sure that it's always a pleasant atmosphere. That means so much to me. And if you want to be a part of the group, the prerequisite is going to be that you're kind and that you're nice. This video was pretty long, so I decided to chop it off right here. I hope you guys enjoyed, and as always, I'll see you in the next one. Thanks for watching. Love you. Bye.